We are going to go over 360-degree breathing and core bracing. Now, it's really important to remember that the diaphragm and the pelvic floor work together when we perform a 360-degree breath. So when our diaphragm and our pelvic floor are working well together, we have a more efficient pelvic floor and core canister system. So when we inhale, the diaphragm and the pelvic floor will lengthen or descend, and then when we exhale, they come back up to their neutral position. Now, it's really important when we're working on bracing appropriately that we initially start with breathing better, right? So a lot of times folks will chest breathe, they'll use their upper traps, they'll use a lot of their accessory neck muscles, and an inhale looks like this, right? So now we're doing kind of an opposite pattern where, again, we're not inhaling down into the pelvic floor, we're rising up, okay? So first and foremost, we want to decrease any sort of chest breathing and upper trap breathing, if that's kind of our go-to strategy. It also kicks on that sympathetic fight or flight nervous system, so it can be really helpful to work on the 360 breath first. Now, I have a yoga block that we'll use as well to start with our core bracing, which can be really helpful to really find those lower abdominals. Now, a lot of times, folks, when they are working on bracing, they suck in their stomach, or they, in this position here, they might have been given cues maybe by a trainer or a physical therapist, somebody at the gym, to really bring the belly button down toward the spine. And that doesn't really allow us to breathe well, right? So it's really important that in order to have a good exhale and brace, that we have a good inhale to start. So instead of creating this pressure around the midline by squeezing everything in, or by using our upper abs and pushing down, we want to utilize our lower abdominals more efficiently. So I'll have you take a good deep breath in first. You can place your hands on your rib cage to really get the ribs moving laterally or outside into your hands. And then in order to really find the lower transverse abdominis, we are going to exhale. I like to think about finding the two pointy hip bones and drawing them together and bringing the pubic bone up towards the ceiling slightly. So again, it's an inhale, exhale, drawing up and in. Now, a good way to see if you're bracing too much is, can you breathe still, right? So I'm holding my brace and I can still breathe through my rib cage. If we are sucking in and pushing too hard and you can't breathe, then your brace isn't going to be super efficient. You can use your yoga block or a pillow in between the knees to practice inhaling, exhaling, squeeze the yoga block as you tilt. And I feel this a lot in my lower abs. So give that a try. Play around with, again, different efforts and see what feels good for you.